welcome to this brand new episode of Newsmakers, the show where we bring to you trailblazer personalities and their success stories from various walks of life. Because at Newsmakers, we really aspire to inspire you. My dear lovely audience, I'm your host Simran. I'm so very excited to be bringing to you an amazing guest on our sets today. He's done amazing work in his industry. We are so happy to bring him here for the second time on our sets. He is Dr. Sujit Paul, who is the Group CEO of Zota Healthcare. Please allow me to welcome him once again. A very warm welcome to you,
Thank you, Simran, for getting me out here. Thank you.
It is such an honor to be having you for the second time. And we are so happy. We would like to know about your journey of how you started and you reached to this level. You are an amazing person. You're an amazing boss. You're leading an amazing team and you've reached to this level. But I would like to know your journey, your life journey, how you reached to this level.
Well, thank you, Simran. Thank you, my dear audience. It's always pleasure to come to this set where I talk to you directly. Life have not been so simple for me. Most youths, most youngsters, they have initial goals, they have initial dreams, but they don't work towards it, and hence they could not reach onto them. By the grace of God, I have tried to work on my dreams and goals.
Wow.
I was extremely passionate from my early days, and I had very big goals for me. And I kind of time frame my goals. Not that I have achieved everything, but I have tried to achieve as much as I can. So I think very important is that you time frame your goals. If you don't do that, then you will not kind of achieve what you intend to achieve. So I have had my own journeys of wins and losses. I had my own journeys of failures, extreme sense of failures, where the failures encountered that I have lost everything that I had, including my money, my car, everything went off. And from there I restarted back again. I fell down, I restarted back again. The journey that I did was not what you see today. But I always worked at least 20 hours in my younger days, and now still today I work at least 14 to 16 hours.
Wow.
So I think it's extremely important that people have their dreams, have their goals, but they work hard. And you need to understand that to really grow up in life, you need to not only aspire, but you need to work towards the journey that you want to set for yourself. And that's what I did, and that's where I am today.
This is so amazing to hear. Here, my dear friends, that you got to hear that somebody who's coming right from the scratch. He started, he also shared, he also faced failures, and now we have an amazing person sitting. I've been so vocal and so repetitive when I say that you're an amazing person.
Thank
now
you.
I would like to go to the second question, which is again a very important question. Now we see that these days doctors are prescribing those branded medicines. But we do see that people are shifting onto those generic medicines of Davaindia. Now we would like to know why is it and why are people shifting to it?
So please understand that there is very less difference between branded medicine and high quality good generic medicines. The molecules are almost similar, the efficacies are very close to each other. So when the end patient or the consumer understands that a good quality generic medicine have that same amount of potency and power, and with less than half the cost, it's definitely worth it to shift and save that amount of money. And that's what Davaindia does. It gives the best quality generic medicines at a very affordable price. And there is where, in spite of physicians writing branded drugs, of course the world is shifting, but end consumers are now getting more and more educated and knowledgeable, and now that they are understanding the power of generic medicine, they are also shifting to great Davaindia generic medicines.
Yes, I do see that, and I get to hear a lot of Davaindia, and people are actually shifting because, of course, your USP is what I see that they're very cost effective.
Yes.
It is absolute. If you say it's generic, it is absolutely for the general public, and they're using it so well. Now, when I say, this is a very important question that is here, that how do you ensure that these generic drugs, like which we have from Davaindia, there are very rigorous standards that we have. How do you manage to meet them?
We ensure that whatever generic medicines are sold from our retail stores, they are been sourced from the best of manufacturing units that we have. So the country have very good manufacturing units. So these mostly comes from the same manufacturing unit from where you get the leading brands of medicines which comes out. So basically the manufacturers of those branded medicines and Davaindia generic medicines in many cases are almost same. So we ensure that the qualities are at par to any other great branded medicines. So there is a huge quality assurance that actually goes through the all the manufacturers are all accredited. So we always ensure that quality comes first for us.
Okay, so here audience, we have got to understand that the quality of the product is absolutely bang on. If you say that it is a low cost price, there is no compromise on the quality and the kind of potency which is required for the body.
Absolutely.
Yes. So now I would like to ask you that how do you see this generic medicines, this acceptability in India and abroad?
Sure. If you see the data points and if you do a little bit of Googling, you will find that audience would also understand, if you do your own research, you will find that India is one of the largest exporter of generic medicines across the world. If you see the data, whether it's UK, US or part of Europe, the average movement of medicines goes to close to around 78 to 81% in terms of generic and very few branded. India is adapting, and India is also going in that direction. Our Honorable Prime Minister have rolled out a very ambitious project called Jan Aushadhi, which operates a generic retail chain of stores. Same for us. So India is progressing and marching ahead in generic medicines much stronger, because if as what I told you, the data points of overseas in Europe, US, UK is close to around 78 to 82% of usage of generic medicines. We are far away from there. For us in India, it's more of brands, but India is shifting, and especially for chronic disease, India is shifting much more faster. People who are diabetic, cardio, gastropeds, India is shifting there much faster, because there is where there is a regular usage of generic medicines every single month, and there is a huge value that can actually accrue to the end patients or to the consumers.
Okay, that's really wonderful, and like you're saying that you're working towards the Prime Minister's mission also. And this is one thing that we need to understand, that how Dava India is diligently working towards the goal. Now, what are the strategies in your Dava India that you're employing to educate the consumers and the healthcare professionals?
Well, see, typically what happens is medicine is a serious business. So for the end consumer or the patient, how it happens is that if a physician have written a branded drug, at times the patient first need to understand what is the relevant molecule for that. So for that we have enough educational materials in the stores. We have our registered pharmacists in the stores who educate the end consumer and patient to understand that if they take equivalent of generic medicine, what is the value and what is also the rupee value savings that they would get. So there are enough handouts, leaflets, promotional materials, everything that goes out. We also have pharmacists who talk about ADR, DDR to the end consumers, which is adverse drug reaction, drug reaction, FDR, food drug reactions, etc., so that a consumer or a patient takes a balanced decision whether the consumer or patient wants to change. It's important for us to educate country, because if countries in Europe, US and UK have already shifted, it's time that we also educate our people to understand that look, high quality generic medicine is the solution for tomorrow, and that's what we are doing at our stores and from our other retail chain of outlets.
So a wonderful thing to know that how you are educating the audience here, educating the normal public as to what the importance of generic medicines. Now I've been knowing that Dava India works really cautiously. They work for women centric initiatives that Dava India takes. Please tell us all about that.
Well, I am a great believer that the sole power source that each one of us come from is women, and that's the truth. Yes. Now it's very unfortunate at times that this truth are forgotten by many and men. So we have ensured that as part of our movement for Dava India, we hire women centric movements. At Group CEO's office, we have lot of women who are part of the highest elevation team. At pharmacist level, we ensure that almost 20% of the bracket have now moved. So initially we had 3%, then we moved to 5%. As on last month, it was 16%. As I speak today, it is 19.4% of women that we have hired as women pharmacists in the stores. We do a lot of work for women in the village by the program called #Change, where it's a social initiative, but more than social, it's an initiative that women need, where we are working on the menstruation cycles of women, where we are working on women hygiene, because women are very prone to UTI, urinary tract infections, where we are working on those grounds. We are working with women who are deprived and who needs our support. So I think there is tremendous amount of work that is going for women, because I feel that unless a country work for women, be your mother, be your sister, be someone on the street, someone on the road, someone at someone else's family whom you don't know, if you don't elevate the women, then no country can progress. And that's what we are working at our organization, out of the organization, in the country, urban and rural.
This is one of the things which is really close to my heart, and how amazingly that you're working for women. And very importantly, you just said that hashtag change. Yes. So my dear viewers, this is the need of the hour. We have to take care of the women of our society. I've been very vocal about this particular fact in my last video. Now here again telling everyone, hashtag change. This is important. We should take care of the women of our society, because just women, through women you get the future of this country, for the world. And hashtag change is the hour. Please do make sure to follow this hashtag change. Thank you so very much for this amazing thing that you have just told me. Now, when I see you as a person, you're like, as I've been saying, you're so dynamic, and you're working. I do see your team is, you have a beautiful team of people, and of course I do see there are a lot of women working for you. Now, what is the raz behind this man who is like, you are, I mean, I would like to know. I absolutely use this word raz because I want to know the story which leads to you become this way, that you are also managing your work so passionately, and your life, and Dava India, and so many other retail chains.
Well, I think whatever I do with a lot of compassion and love. So for me, I don't work at anything. So and whatever I do, those are priorities for me. So in terms of work, it's not work for me. It's my own lifestyle that I do, and work is just a derivative for that. In terms of my people, whether they are men or women, they are none but they are me. So that's how I take them, and it's not that I only speak to them about work. I speak to them and holistically about what they should be. So as a coach, as a mentor, as their boss, as their colleague, as their friend, it's important for me to understand my people well. It's not practically possible for me to understand all my people through physical approach, because there is where we take technology into help through usage of various technological platforms. The people who work with me very closely, I ensure that it is my responsibility to give them a different direction for life. It is my responsibility to make them not only more comfortable, but to make their life more meaningful. Wow. And that's extremely important for me. So I try to balance everything put together, and at the end of the day, to ensure that we done a great organization that would build genuine value for the country of India.
This is really seen here. I have noticed, and I would really want to tell you that we are sitting here next to a person who is absolutely doing amazing work. And I've been like I've been saying, I'm really repetitive of this word because I totally believe in it. He's just not amazing as a person, is doing a great work as well. Now I would like you to tell us about the different innovations. What kind of changes, how are you going to foresee these generic medicines? What changes, what innovations, what new things are you going to get?
Well, I think we are working extensively with automations at this point of time. So we have the best of Gen AI tools and similar. The change that we are building is not only the innovative products, but also the innovative models that we are building. For example, people who are vegetarians, they have very high probability to have deficiency of methylcobalamin or B12. So for them to go to a hospital and take a medicine shot is only through injection, which costs quite a lot. Now, since everyone cannot afford, we have a medicine that you can just put, this is a very thin strip, you just need to drop the strip in your tongue, and that same usage happens exactly what you would have taken in a hospital and have taken a syringe injection. So you don't need to go to hospital anymore. So those kind of innovations in products are coming out. Wow. We have amazing gummies where we have prebiotic, probiotic gummies, we have ashwagandha gummies, we have biotin gummies for people who have less deprived sleep, we have melatonin gummies. So we are working innovation all out. We have at least some 8 to 10 different class of toothpastes which are half the cost or less than half the cost of what the market ranges are. We have the best of health drinks like Boran Vedic, which have less amount of sugar, high amount of protein content, and half the cost of the nearest competitor. We have an amazing malt drink called Hormilk. So we have the best of serums that you have. We have the best of skincare products, healthcare products. We have done huge innovation on hair therapy. So hair therapy is one section that we are working on very closely, and in the next couple of years we will work more focusedly, where we are working to ensure that women's hair are more strengthened and you have more hair growth. So there are a lot of work that we are doing at Dava. It's not only about medicine, it is about health and wellness, and it's about how you will be more healthy, how you will be stress free, how you will have more brightening in your body and mind. That's what we are working out.
Wow, so we've got so much on the platter here. It's just not one product. They've been working on various products. Here I would like to urge to my audience, you have to shift to Dava India. It is the need of the hour. They've come up with different products, and you know, women needs to have good hair, good skin, good body. Not just women, all men. Everyone needs to be groomed and looked amazing, and now we know where to go. In case you have some kind of a problem, you have to shift to generic medicines, and Dava India is available all through. Now, where are you expanding to? Which all places like Dava India?
We are present now all across the country. We are present in east, west, north, south. As I was coming here, I just saw a Dava India store. So now we are everywhere in India. So wherever, in whichever part of India we are there.
So now India, do you also go to, you foresee yourself going abroad?
For abroad, yes, we are working out very closely with couple of other governments of different countries, where we are working to help them set up the similar chain for the improvement of those countries' healthcare ecosystem.
So I really wish that you go places, you move abroad, and you know, I really wish that a lot of people get those benefit what Dava India as you have a motto to achieve, that everyone should be free from they should be healthy. Healthcare is very important. Now when I come back to you as a person, now here I have also would like to understand that as a CEO as a group CEO of Zota Healthcare, you are managing a huge organization. Now how do you keep your employees intact? Do you also give them some trainings? What is the kind of ideology that you have for your teammates and your
of course employees? Yes, I think all our people do undergo training, but people who are part of the core committee who actually govern the entire stream of Dava India, they are privileged to get much deeper training what the organization feels they should be, and most of it is I get in touch with them, and I always work on simple principles of values and culture. We don't work anything only on financial numbers as an outcome. We work as to know how they can ensure that they do the right kind of thing. Now when you work on the psychological neurons of the team members, that how they can build value to the end consumer, because my only mission is that 1.3 billion people we have in India, for all these 1.3 billion people that we have, if we can ensure that everyone have a Dava India generic medicine strip in their pocket, then we'll have a healthy India. We'll have an India who can afford medicines. We'll have an India where mothers don't need to cry that they can't afford medicine for their children. We'll have an India where women do not need to feel a stomach ache that they can't afford medicines, or women cannot afford sanitary pads. We have amazing affordable sanitary pads. So my sole objective is that our people, each one of us, should be so well trained and compassionate that they understand that how to value and save lives. And it's not only for humans. If you go to any of our own stores across the country, you will see that there's a water ball kept on the outside of the store, and where fresh water we give, so that even in the hot summer animals can quench their thirst. So it's the whole perspective is that how you can touch lives in a much better way.
Wow, so a great leader, this comes out from a great leader, and this shows that how important it is for you to save life. You're saying that Dava India has those strips that can save life for you. I've been telling the audience, and I've been very, very perpetual of this, that this is the hour that you need to shift to these generic medicines which are affordable, and they're so friendly. And for our women friends, you know where to go in case you're looking forward to have a sanitary pad, and sometimes it's a stomach ache, and there are a lot of things that we women deal with. So Dava India is the answer for it, and we Dr. Sujit Paul sitting next to us, we are so happy that we are getting so much knowledge. Now moving further, this would be the last question. I would like you to give give us that amazing advice to our audience who are watching you right now, that how can they put themselves into this healthcare industry. In case there is a professional who is watching you, how can he become like you? And for the generic people, how can they be fit and healthy like you are?
So, my dear audience, it's always an endeavor that, how I work is that every single day I work, I try to add value on that day. Even if they are close people of mine in the organization, or people who are my customers, patients, my retailers, we try to add genuine value. So, if you are a new entrepreneur, or if you are a young budding entrepreneur, or if you are a youngster who would like to kind of grow up in your life, just ensure that whatever you do with genuinity of your belief, values and cultures. You genuinely believe that you are working for the good of someone. You genuinely believe that whatever you do, that will enhance our genuineness of greatness to someone else. But at the same point of time, for all other Indians who are seeing this, if I have to tell you one thing, just try to touch some life every single day. You don't need to have money to do that. Even if you're driving on the road, if someone is crossing the road, if you just stop by and allow that person to go, you have done one good thing for the day. And if all of us start doing it, we'll have a different India altogether.
Wow, what an amazing advice that we just got from Dr. Sujit Paul, which is do good, and you can see the change in the society, like he's bringing change. Kindness is the key, is the need of the hour. Be kind to people, like he's told that what all he does for his employees, for the people, for the society, for the women and for everyone. And here we are so happy once again to have you here with us on the sets of Newsmakers. We really cross fingers that we may get a chance to interview you once again, maybe third, fourth and 100th time, and get to have this amazing knowledge from an amazing person. So thank you so very much, Dr. Sujit, for being here. And my dear audience, today I was really happy. You could see that on my face, because I got so much of knowledge here. And here I am promising you that I will be coming soon with another dynamic guest. So stay tuned, and yes, you have to follow what you need to do. Stay kind. All the best.